Today we're going to talk about Asian eyelid surgery, and I'm going to discuss a hot topic in the field, which is which is better, the incisional method or the suture method. The incisional method has several advantages. It's a very precise operation. It's got a very low breakage rate. However, one of the potential problems is that the procedure is surgeon dependent, meaning if it's a good surgeon, you're going to have a good result. If it's a bad surgeon, you're going to have a bad result, and it's going to be a little bit difficult for the patient to decide. The suture method is a supremely natural appearing procedure, and it's got a very quick recovery time. One of the criticisms of the technique, however, has been that it may possibly be prone to breakage. What I'm going to discuss today is a unique method that we use, which is called the DST, or the double sutures and twisting method. This method is special because it's got a very low breakage rate due to a special technique involved in the technical aspects of the operation. The breakage rate for this operation is about 1% per year, which is very, very low. Here is an example of a 27-year-old patient who had a DST procedure about 4 days ago, and you can tell that there's some very slight bruising, but she's very presentable and she can go back to work. The double suture and twisting suture method is a very specific type of suture method that improves the breakage rate that's been associated with the traditional suture method. The traditional suture method was prone to breakage because the sutures would cheese wire through and tear right through the skin. However, with the DST procedure, the breakage rate is reduced because the sutures are interlocked like this, like a chain link fence, and this is secured to the tarsal plate, which is the deep cartilaginous structure underneath, and also to the skin. So this locks in the skin very firmly to the underlying lid structures. And here is some anatomy to point out. Tarsal plate is identified by the letters TP, and that is a firm structure which is going to allow us to secure the skin with the suture method without the fold breaking so easily. Here's an example of a patient who had the double suture and twisting technique, the DST technique, along with a medial epicanthaloplasty, which is the removal of the inner fold of skin. And you can see she's a little bit further out with almost all of her swelling out. And you can see that it's a very natural appearance. In contrast, an incisional procedure gives you an excellent result as well. The fold is a little bit more stylized and a little bit larger. So if that's what you prefer, then an incisional technique with an experienced surgeon is the appropriate procedure for you. Here is an example of another patient who had an incisional surgery. She needed incisional surgery because she had some fat in her upper eyelids, which needed to be removed along with a little bit of skin. Here is an example of a patient who had prior incisional surgery that failed. So even though we frequently talk about a suture method failing, in fact, an incisional method can fail as well. And in this case, I was able to correct a prior incisional method with the DST suture method. Now, what is an ideal DST candidate? It's going to be someone with thin upper lid skin, minimal fat, and the brow is going to be in good position. And here's an example of a 26-year-old with those characteristics. And when I describe to you step by step how the procedure is done, this is what I do. The patient comes in and we go over the size of the fold and the shape of the fold. And the patient points out exactly with the wire clip how she would like to have the fold made. I'll then trace it out with a marking pen, and then she'll look at it again to verify that that's the shape that she wants. Then we'll recline her, prep her, put it in a little bit of local, and then the sutures are placed. The suture part is very quick, takes 15 or 20 minutes. The markings, which is just as important, takes 15 to 20 minutes as well. So you can see the markings are a very important part of the operation. That we showed shows her result at 3 years, and you can see that the folds are very crisp, precise, and they're holding up over time. Here's an example of a patient who had the incisional method, and she wanted a more dramatic and larger fold, and so we did the incisional method for her. Here's an example of a patient who had excess upper eyelid skin, and she required an incisional method to remove the upper lid skin. I'm using this patient to point out the fact that incisional surgeries are not completely benign. This patient had a prior incisional method, and on her left eye, you can see that the muscle is a little bit dysfunctional. The eyelid is a little droopy on the left side, and it required correction. So I corrected her upper eyelid skin with an incisional method and tightened up the muscle underneath. Here is another patient who's a little bit older, and she required an incisional method combined with a brow lift to put the brow in the appropriate position. She's about a 40-year-old patient, and you can see the upper lids look very natural and the brow is in good position.